My name is Allison Stewart, and today I'm going to be talking about pulmonary compliance. Pulmonary compliance is how easily the lungs can fill with air and stretch. We can think of the idea of pulmonary compliance using the analogy of a balloon. When we fill up a balloon, balloons are very, very stretchy and they fill with air very, very easily. With healthy pulmonary compliance, that is what it might look like. There is high compliance and low compliance. High compliance implies that the lungs stretch very, very easily. But if they stretch too easily, then it is harder for them to go back to their original position. Low compliance means that the lungs are very, very stiff. And it means that it is also harder to breathe in and it takes a lot more effort to breathe in. There are a lot of factors that affect pulmonary compliance, and that includes the elasticity of our lung tissue. The elasticity of our lung tissue allows the lungs to stretch during inhalation, and it also allows them to remain compliant. Water content also affects pulmonary compliance. If we remain hydrated, then it can also balance out our lung compliance and make sure that we are breathing effectively. Surface tension can also affect pulmonary compliance. There are lung cells, which are alveoli, and within those lung cells, there is a layer on the outside of them called surfactant, and that is the fluid on the outside of the alveoli. And surfactant affects the surface tension within our lungs, which then in turn affects our compliance. Compliance can also be diminished by different things. Conditions that cause a lack of elasticity, like scarring of lung tissue, could affect or diminish compliance. Blocking of the bronchi and airways can diminish compliance. Our bronchi are basically the different parts of our lungs, and certain airways can be blocked, which could also diminish compliance. Examples of this could be mucus buildup. Also, conditions that affect surface tension can diminish our pulmonary compliance. If there is conditions that impair surfactant, which we talked about earlier, it can affect our compliance. And conditions like that could be conditions like asthma. And asthma is basically where it is very hard to breathe in and out. And that is basically what compliance implies. We can apply the idea of pulmonary compliance to diagnosing different respiratory conditions. Depending on the severity of pulmonary compliance, we can understand and help understand what types of diagnoses we need to make. Overall, pulmonary compliance is very, very important because it helps us to understand how our lungs breathe in and out